Breathing. It's second nature to all of us. We don't give a second thought to the thousands of breaths we take in each day. We don't even think about what's in the air we breathe. If it contains dangers we can't see, or smell, or feel, we just breathe in and out, in and out. And we don't even notice this basic human function until we are placed in a situation where breathing becomes difficult or even impossible, where fighting for each breath is a matter of life and death. When you're on the job, safe breathing is important too. You have to think about what and how you're going to breathe when you're on a work site. There are some situations where the atmosphere is dangerous and could lead to permanent adverse health effects or even death. This is why we need respiratory protection.
Over the years, I've learned how to use a lot of tools, but none of them's more important than my respirator. In this video, we'll take a look at the basics of respiratory protection, what you need to know to protect yourself from respiratory hazards on the job.
There can be many hazardous places on the job site, especially when it comes to the air you breathe. That's why it's important to take personal responsibility for your respiratory protection. Your employer has to make sure you get the proper training on respiratory hazards and how to avoid them, and provide the proper equipment for you. But it's up to you to use the equipment in the right way.
Some people I've worked with won't wear respirators because they think they're too uncomfortable. They put a lot of pressure on your face and leave marks. The old ones weren't the greatest, but the new types are a lot more comfortable to wear and easy to use. Considering the risks involved, respiratory protection is certainly worth the effort. Breathing hazards come in many forms, and sometimes you aren't able to see or smell the danger, so you have to know what to look for.
Common respiratory hazards at work usually involve the presence of harmful substances in the form of dusts, vapors, or fumes, and oxygen-deficient atmospheres, where the oxygen level is below 19.5%. Some contaminated atmospheres can be immediately fatal. Some can cause tissue damage to the lungs and other body organs. Other contaminants may cause less severe effects, such as dizziness, slurred speech, or nausea. By wearing a respirator, you can protect yourself from these hazards. Respirators keep contaminants from entering your lungs when you breathe. Some respirators also supply you with fresh air, so you can work in areas where there isn't enough oxygen or where you need more protection.
The whole topic of respiratory protection is so important that the government has established respiratory protection standards. These standards require employers to take specific steps in providing respiratory protection.
First, when there's a health hazard, employers must supply suitable respirators. Second, employers must have a written respiratory protection program that includes step-by-step instructions for selecting, fitting, using, and maintaining respirators. Written procedures help you to know exactly what to do when it comes to respiratory protection. Make sure that you're familiar with your company's procedures.
Written procedures may also help to determine what the respiratory hazards are and how to choose the respirator that'll protect you best.
There are two categories of respiratory equipment: air purifying respirators and atmosphere supplying respirators. Air purifying respirators use filters or cartridges to remove or neutralize contaminants from the air before it's inhaled. Filters are used to remove particulates, like dusts and fumes, from the breathing air. Cartridges and canisters remove certain gases and vapors from the surrounding air. Filters and cartridges can be used in a variety of combinations, depending on the job hazards.
Remember, air purifying respirators do not supply oxygen, so they can't be used in areas with low oxygen levels.
In those situations, you need to use an atmosphere-supplying respirator. Atmosphere-supplying respirators supply uncontaminated breathing air to you from a source other than the surrounding atmosphere. Two examples are an airline respirator, which allows you to get fresh air from outside of the contaminated area, and a self-contained breathing apparatus, or SCBA, which allows you to bring breathable air into contaminated areas. The air supply may last from half an hour to 4 hours, depending on the device.
All types of respirators must be tested and approved before you use them.
A good way to check this is to look for approved labels on the cartridge or package. This means the respirators and attachments meet minimum performance standards.
Before using a respirator, you should always carefully read the instructions that come with it and make sure you understand its proper use and limitations.
Never alter or remove your respirator, even for a short time, when you're working in a contaminated atmosphere. And never use one manufacturer's filters, cartridges, and assorted parts with another's.
It's important to keep your respirator in good condition and to wear it properly. A respirator that's damaged or worn improperly won't protect you from the hazards. Each time you use a respirator, thoroughly inspect it.
First, make sure the straps aren't too tight or too loose. Check to see that the buckles are connected, and make sure the valves are in place and working properly. Once you know that the respirator is in good condition, you're ready to put it on. Attach the bottom strap. Fit the respirator snugly from the chin upwards and attach the top strap. It's a good idea to wear it high on the head for a better seal. Also, make sure that your hair, eyeglasses, or anything else doesn't interfere with the seal to your face. Since beards and other facial hair can reduce the respirator's effectiveness, absolutely no hair is permitted between your face and the seal. Remember, a respirator is only as good as the seal between the facepiece and the user's face.
You can check to make sure the respirator fits properly, providing a tight seal with no leaks, by doing fit tests. Usually you'll perform these tests with your employer when you first get a respirator. It's important to remember to repeat them each time you put your respirator on.
Start by adjusting the straps, making sure you get a comfortable fit without over-tightening. Then, test the fit by moving your head from side to side and up and down. You can test the seal by performing both a positive and a negative pressure seal check. To perform a positive pressure seal check, gently block the exhalation valve of the respirator with your hands, using enough pressure to block the valves but not enough to push the respirator against your face. When you exhale, the facepiece should bulge outward. To perform a negative pressure seal check, block the filter or cartridges with rubber gloves or something else that creates an airtight seal. Do not use your hands because the pressure will affect the test. Inhale for 5 to 10 seconds. The facepiece should collapse without any air leaking around the seal. If you detect leakage in either check, readjust the respirator or try a different size or brand. After successfully completing the positive and negative pressure seal checks, you need to perform a qualitative or quantitative fit test.
The qualitative fit test checks the respirator seal by seeing if you can detect odors through the respirator. The quantitative fit test uses instrumentation to test the fit of the respirator. Once you've found a well-fitting respirator, it's up to you to keep it in good working order.
Before and after each use, inspect your respirator for wear and deterioration. Pay special attention to parts, such as valves, which may wear out. Also, check the condition of the facepiece, especially the face seal surface, headband, valves, connecting tube, fittings, filters, cartridges, and canisters. Make sure all connections are tight. SCBA equipment should be inspected at least once a month. If it's used on a regular basis, it should be inspected after each use. Air cylinders should be fully charged and regulator and warning devices checked to make sure they function properly. Once you start to use your respirator, you need to pay attention to how it's protecting you. For example, your employer will have a schedule for how often filters and cartridges need to be changed. However, Anytime you feel resistance to breathing or taste or smell a substance, replace the canisters, cartridges, and/or filters. Also, if you're having any difficulties breathing or fitting, make sure to tell your employer. It's also important that you clean and disinfect your respirator regularly. If more than one person uses a respirator, clean it between uses. First, remove all filters and cartridges. Make sure these stay dry during cleaning. Wash the respirator in a mild detergent solution and then disinfect it with a sanitizing solution. It's best to allow the respirator to air dry so it won't lose its shape. When the respirator is dry, place it in a resealable plastic bag or other airtight container with the face pieces and exhalation valves in a normal position. This helps prevent distorting the rubber or plastic and protects it from dust. Store it in a clean, cool, and dry location. Your company may have a designated wall cabinet for storage. The cartridges should also be stored in an airtight container, like a resealable plastic bag. This is important because when cartridges are left out in the open air, they continue to absorb contaminants and, as a result, may have to be replaced more often.
Breathing. It's something you do all the time and without even thinking about it. Most of the time you don't have to, because the air around you is safe. But when you're on the job, you could run into situations where it isn't safe, where inhaling the air could damage your body or even be fatal. It's these times that you need to take a personal responsibility for your safety, and that means using a respirator. Your respirator is one of the most important pieces of equipment you use to stay safe on the job. By knowing how to properly use and maintain it, you can continue to work safely, and that helps us all breathe easier.